Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Spironolactone. Its brand name is Aldactone. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how spironolactone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe spironolactone. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does spironolactone work? Well, spironolactone is a renal competitive aldosterone antagonist. It inhibits the effects of aldosterone by competing for the aldosterone-dependent sodium-potassium exchange site in the distal tubule. It increases secretion of water and sodium while decreasing excretion of potassium. Now, in terms of indications or reasons we would prescribe this medication to a patient, we may see it used as an adjunct or add-on therapy in hypertension or high blood pressure. We may see it used to treat hyperaldosteronism or New York Heart Association Class 3 or 4 heart failure. Medication may be used to treat edema associated with cirrhosis of the liver or edema with nephrotic syndrome. With respect to contraindications or reasons we would not be able to prescribe spironolactone, we wouldn't give it to a patient who had a hypersensitivity to spironolactone or any other component of the formulation. Patients with Addison disease would not be able to use this medication, as well as patients with hyperkalemia or high potassium levels. Note about dosing with spironolactone. So as an adjunct therapy in hypertension or high blood pressure, the initial dose would typically be 25 to 100 milligrams per day in a single or divided doses. The patient may adjust the dose after 2 weeks of therapy, and doses over 100 milligrams per day generally do not provide additional reductions in blood pressure. If they are treating edema associated with cirrhosis of the liver, the initial dose may be 100 milligrams per day, orally in a single or divided dose. The range would typically be 25 to 100 milligrams per day, and use for 5 days is recommended before increasing the dose. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using spironolactone, so we'll go over some of those here now. Gynecomastia, or the development of breasts, may occur. Diarrhea, nausea, and vomiting are possibilities. Some patients may experience somnolence or menstruation disorders, as well as erectile dysfunction. The more rare but serious side effects would be Stevens-Johnson syndrome, toxic epidermal necrolysis, or electrolyte disorders. That's all we're going to talk about today with spironolactone or Aldactone. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.